Chair Scott,
Present.
you have a quorum present.
Thank you. Then we will get started then. Okay. And roll call, all in favor?
B, Chairwoman's remarks.
I have none, thank you.
Moving to item C, approve the March 12th, 2024 meeting minutes.
Move my, are we using the thing? Oh, okay. Okay, I can't even see.
We have a motion by Commissioner Anderson and support by Commissioner Killeen.
Yes. All in favor? Here. No. Yeah, all right.
Motion carried.
Thank you. Next item, please.
D, unfinished business. There is none listed. Moving to item 1, under new business, forwarding the juvenile justice report for fiscal year 2023.
Okay, is there someone want to give this report? Aye. No, I think we can now.
Hi, good
Yeah,
afternoon.
it's better.
Hi, I'm Tia Loran. I am the new Deputy Director for Juvenile and Youth Services, and I'm filling in for Director Melissa Fernandez.
Okay.
And
Thank you.
yes, and on our agenda, we do have the new fiscal year 2023 annual report that we created. Just some items I would like to note. If you guys haven't had a chance to read it, it is a very long report, but it outlines improvements. So we do have for 2023, recidivism for adjudicated youth has decreased, which is fantastic. The probation level 2 average length of stay in treatment has decreased as well. So youth are getting de-escalated quicker and getting back to community and back to their home and families. The youth confined at JDF, the level of days has decreased, an average of 32 days per stay. And we do have lots more youth who are serviced in the first contact prevention.
How many youths do we have at this time?
At JDF? Yes, so at JDF, there are, as of today, this morning, there are 77. We have 9 females and 68 males, and we do have 8 females at our Calumet location as well.
Thank you.
You're welcome.
Commissioner McCormick.
I'm sorry, you said you had 8 female, the last part, I
Yeah.
missed that.
Yep, so at JDF, we do have 9 females, and then at Calumet, we have 8 females that go there for Calumet, yep, which is our location at Spectrum. So they hold some of our females for detention.
Okay, yeah, but where is that?
That's in Highland Park.
Highland Park.
Yes,
Okay, I
ma'am.
just wanted to clarify that.
On
Thank you.
Glendale Street. Mhm. Okay, any other questions? Commissioner Killeen?
Thank you, Madam Chair. Yeah, I have had the opportunity, I actually latched onto a copy of this report a little while ago. I highly recommend everybody read it. It is chock full of data, and for this committee, their understanding of what's going on in the system, and all the different levels that we have for youth, right? Whether they're at home on a tether, or a judge says this, or, you got a bunch of different classifications. But I'm going to reiterate again, the recidivism rates, it's stunning. When the state had this system and Governor Engler decided, no, we're not going to spend money on this. Counties will send you the money. You worry about this, right? So when the state had this, we were looking late 90s recidivism rates of over 60% for our youth. And they were going to exciting places like Boys Maxi Training and learning to be real criminals. Since we've taken this and the county attitude's not the right word, that not incarcerate, keep in the community, bring services there. It has 2 effects. One is it lowers recidivism rates, and it's more effective, and it's cheaper to do so. So now we're pushing recidivism rates around 8%.
So for 2023, we have 3.9% for the adjudicated youth.
For the adjudicated.
Yes.
Now there's different categories, but
Yes.
we're well below And so I think it speaks to the success of the county approach to juvenile justice. So I highly recommend a little bedtime reading and going through that report. So thank you, Madam Chair.
All right. Oh. Commissioner Mareki, please.
How long do you follow these kids to see what kind of recidivism rate there is?
Yes, so we go all the way up until the age of 19.
Oh, okay.
Yes. And then past some if two, but they, at 18 years old, they do go to Wayne County. And then if they are terminated, then they don't no longer have a CMO.
Okay,
And so that's when the cutoff starts.
that's when you stop it.
Yes.
Okay, so if they enter this program or whatever at 14, you follow them all the way through till they're 19?
Yes, ma'am.
Okay.
While they're in juvenile, the system, yes.
Yes, thank you.
Madam Chair.
Thank you, Commissioner Monique.
Thank you, Madam Chair. That just made me think about the youth that were there a year ago. We had like 130 something youth. And the state now, I guess, took them, and I'm just wondering where they are at this point. I guess 60 youth, around 60 youth.
So are you
I
able
don't
to
know if you have
elaborate
that.
age?
No,
No.
no, we had about 130 youth
Okay.
in our facility, and then we had to get the state to come in and take them for treatment because they were just sitting there waiting on treatment.
Yes.
So now we're down to 77.
Yes.
Which is wonderful.
Mhm.
I'm so glad, but I was just wondering where those others are,
Yeah.
at this point, and do we track them?
Yes,
Yeah.
absolutely. So
Mhm.
all Wayne County youth that are within our county in the juvenile system, they are tracked. So we do have 113 as of today on a tether, while the 77 are JDF. And then we have many youth, and I can get back to the number, the residential placements that the
Right.
youth are at. And also I can confirm that there are no juveniles in Genesee County or Macomb County Jail. So they are, if they're in detention, they're at our detention facility.
Okay,
Other than that, they are on tether at home receiving services or at a residential placement.
okay. But we don't have the data, or you don't have it in front of you as to where they are.
Oh, yeah, so they
Exactly.
can be at there's many residential
Right.
facilities, and I can get that data for you.
Okay, great.
Yeah,
That's what I'm asking.
Absolutely.
If you could get that. And,
and it'll
yes.
outline where they are,
Where
how
they-
long they've been there.
great. And to that point as well, are they, if those locations are local, did they have some say in being, out further from their family, that type of situation? I don't know if they have a say or the family have a say where they go for treatment. So that was another question I wanted to clarify.
Yeah, so at the, in front of the judge in the court hearing, the parents they can express themselves, express where they want their child, but I think it ultimately falls under the wait list. So if the CMOs are referring a child to a level 2 residential, it's based on the wait list. So who's ever next to take that youth, that's where the youth goes.
Thank you.
You're welcome. Thank you.
Thank you, Deputy. Yes, Colleen?
One more time. Thank you, Madam Chair. But Commissioner Marecki, that question comes up a lot that you asked. And over the time I've been on the commission, right, okay, till 19, right? But I've had a discussion with the department. It's not that hard to track them through like age 25, right? That's all court records. So I think perhaps the committee or whatever have a discussion with the department and saying, hey, we'd like you to add, and that will give us a different picture, and perhaps a more complete picture of folks that have gone through our system and what the long-term. Yeah, so I think that's a discussion to be had because it's not that hard to chase that data down as well. Thank you, Madam Chair.
You're welcome.
And I would think that the state would even want to know that. Well, I would think. But I mean, that could even be better publicity for these kind of programs if if they were staying out for long, long terms. Out of problems, that would be because this is all, I'm sure, according to the state that you follow.
Yes, and within R as well, for the county as well. Yeah.
Okay. But
So as
yeah,
long as the juvenile, is it with juvenile system, we can be tracking them. We can track them later than that as well.
I think that would be a great, as long as they were staying out, it'd be a great plus for the program.
Absolutely. Thank you for the recommendation.
Well,
Well, have we ever tracked them to 25?
no, or some other age.
21 sometimes, but if they are due designated, so if they are an adult case in juvenile, they can be tracked till 21 years old, but that's only for the due designated.
But also Commissioner Maraki, if we take the longer term and if we see increased rates, that is even more instructive to us about how to handle these cases or what really happens in the long run. And then maybe it's with the adult courts that we are looking at something. So whether the numbers are good or bad, I think as policymakers, we need to see them. Yeah, thank you, Madam Chair.
Very good.
And to that point, I think if we see the either positive or negative impact over time, we can make some changes to the program right now. So
Right.
that it just makes sense. I think it
Yeah.
makes sense.
Well, that's great. Thank you all for your history on this.
Yeah, that'd be-
Okay. All right,
Is that a motion receiving?
thank you so much.
Thank you for your recommendations.
Yes. A motion,
We have a motion by
Oh,
Commissioner
I'm
Baker
sorry.
McCormick and supported by Commissioner Anderson.
mine went off.
Yes.
Yep.
Okay,
And we vote.
okay, all in favor?
Aye.
Any opposed?
There.
Hearing none. Thank you. Motion carried. Next item, Madam Clerk.
Item 2, revision of resolution number 2024-124, amendment 1 to a 3-year inmate healthcare services management agreement with a 2-year option to renew with NAPCare Inc.
Good afternoon, through the chair, Ebony McCann, Department of Health, Human Veteran Services, Transition Services Division Director.
Good afternoon. Thank you
Good.
for being here.
No, thank you for having me. The department is requesting a revision to resolution number 2024-124, amendment number 1. We were here last month. It was actually approved by the commission on March 7th. And the amendment aimed to accomplish 3 goals, incorporate key performance indicators, implement a cost savings component, as well as an adjustment to the staffing component. Additionally, we requested the reallocation of funding amongst 4 of the line items within the PO, and it was identified after the resolution had passed that the numbers are transposed. And so we're respectfully requesting the revision of this resolution at the full board hearing coming up.
Any questions?
Well-
Commissioner Kling?
Yeah, thank you, Madam Chair. I'm supportive of this. We did it before. About 6 months, we're moving into a new facility.
That's my understanding.
That's my.
Okay.
understanding too. Yeah. Every once in a while, I read something in the paper about it. Are there discussions going on how to adjust perhaps this contract and personnel, given that we're in a new configuration? Because we have a couple more years on this contract with NAFCare.
So the contract is actually up for renewal. And so once this resolution has been successfully passed and revisited, we will begin the negotiation component of the renewal of our NAFCARE agreement. But to answer your question, Commissioner, yes, we have been discussing with NAFCARE's administration regarding additional staff, and that was what this amendment aimed to accomplish, to incorporate some additional staff to address the growing needs of our offenders or inmates at the Wayne County Jail.
Because I don't know about the configuration and everything over there, right? The right from day one, which actually goes back 17 years now when the county first started talking about a new jail, right? Right away, it was like, oh, new facility, we're gonna have all these operational savings, you know, we're not gonna have to pay any money for this, it's wonderful. So I'm wondering what the new configuration, because, so bring me up on this. This is Amendment 1 to a 3-year management agreement with a 2-year option to renew. So where are we in that 3-year contract, 2-year option to renew?
So we are preparing to, again, initiate the renewal. The current contract expires September 30th.
Are we in the 2-year option right now? Have we taken that?
No, sir, we are not.
This is the end of
This
the
will, yes,
3-year,
correct.
and you intend to RFP this then?
No, we will renew. NAVCARE has renewals
Yeah, yeah.
embedded in their contract. And then I'm not sure the direction that the department will take as it pertains to whether or not a new RFP will be issued. That's something I'll have to
Yeah.
discuss with my administration.
Well, okay, I get you on the RFP, but I'm just wondering if the same level of services are needed at the new facility that we're providing now.
So we addressed and identified the need to include some additional staff, and that was embedded in the staffing matrix that was presented in Amendment number 1. And we are working and we continually have discussions with NAVCARE administration just to ensure that our level of care is suitable to fit our offender needs and the jail population needs currently.
Well, I hope we're telling them that,
Yes, we are.
not the other way around.
No,
I
we,
don't want any
correct.
tails wagging the dog. But your current assessment is in the new facility, there will be actually a need for greater resources for the juvenile?
So this is for the adults within the jail. So this is for the adult population in the Wayne County
Oh, that's
Jail.
right. They only do the adults.
Correct.
Yeah, so we're anticipating then that there's gonna we're moving some money away from adult mental health to fund juvenile services, correct?
So the modification of the reallocation,
Yeah.
there is a component in the contract for juvenile pharmaceutical needs.
Mhm.
And so that was embedded in this modification or reallocation of funding. We are definitely responsible for providing mental health and jail health for our adult population. And that is what the reallocation consisted of.
Yeah, moving some money from adult mental health to the juvenile
Yes.
side. So we're thinking that in the new facility, we'll need more services from NAVCARE than we are in the current facility.
I think as our needs grow, this contract, we entered into this contract at the onset of the pandemic. Our jail population was low at that time. And so as things are opening up, we are seeing an increase in our average daily population. And so there is an additional
That's it
need.
right there, right? When a lot of people weren't in the jail during
Correct.
COVID. So we had kind of tailored the contract to that artificially low population. Now we got to start paying again.
Yes.
Okay. Thank you, Madam Chair.
Okay, thank you. Thank you Mariki? Oh. Showed you. All right, thank you so much.
Thank you all.
All right.
We have a motion by Commissioner Marecki and a support by Commissioner Colleen.
I'm trying to figure this out. Okay. Okay, it's been moved and supported. All in favor?
There you go.
Vote, please.
Motion carried.
Next item, please.
Item 3, requesting commission approval of Amendment 9 to a 2-year contract with a 3 1-year option to renew. with Black Family Development to account for the fiscal year 2024 first quarter payment adjustment to continue providing comprehensive treatment plans to juveniles in accordance with requirements of the juvenile justice system.
Okay.
I said, it looks like we're gonna do that. Move them all at one time.
That's
Approve.
what it seems like. Mhm. Okay, do we need to ask her that to make sure?
Madam Chair.
Yes, good.
Yeah.
Commissioner Khalid.
If I may, these are our 5 CMOs providing the youth services out there.
Mhm.
And 4 times a year, they get paid based on encounters with our young people. So 4 times a year, they turn in their data, right? That either we had more services or fewer services, then we adjust their overall contract to reflect that. And that's quarterly adjustments for all of the CMOs. So that's why the discussion here in the committee is to have one motion for all 5 CMOs. It's all the same thing.
All right. Okay,
It's been moved.
been moved and supported. Please vote.
Sure, that's what I'm here for.
I
Cast
can't,
some votes.
Oh, now I.
Use the touchpad. Here, you have to use the touchpad
Oh.
for mouse. For this computer, because it doesn't have a touch screen.
Motion carried.
Clear
Okay,
catch.
thank you. It's so different. Okay. Okay. Okay, motion carried. Next item, please.
F, such other matters as may be properly submitted before the committee.
All right.
Hmm.
Okay. Let's see who was moved by.
Mhm. Yeah, I just. found
Okay.
it. Yeah, yeah. Nobody is. Think incumbents.
G, public comments.
Oh, that's right, we put them all together.
Right.
Okay. All right. Is there anyone on Zoom would like to speak? Is there anyone on Zoom or on the phone would like to speak?
I think I was born yesterday. Yeah.
See none. Okay. Is anyone in the audience? Anyone in the audience? Hearing none, next item.
Adjournment.
So moved by Commissioner Colleen, supported by Anderson.
My primary ballot
So,
on the first,
all right,
the only office.
motion is carried, all in favor.
It's free